welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today in the show, we have Mike Sevilla. He's a family physician and he wrote the Kevin MD article, A Shutout to Small Hospitals. And I was talking to Mike shortly before this podcast, and I was saying the last time we talked to each other online, I was on his podcast about 15 years ago, and we were just reminiscing about how much time has passed since then, right, Mike?
Yeah, good to be with you. And it's great catching up with you again. And thanks so much for sharing my article on Kevin MD.
Now, we'll get into that article in a little bit, but for those who don't know who you are, can you just briefly share your story and journey to where you are today?
Yeah, so my name is Mike Sevilla, and I was born and raised in northeastern Ohio. And I'm a family physician. I've been here 20 years. I'm in a group practice, physician owned, not hospital owned or owned by any kind of organization. So we're a traditional practice. We still go to the hospital. We still go to nursing homes. We do a lot of longitudinal care, which is what I went to medical school for, and still love what I do and still have students in and just tell them this is still what you can do in primary care. And still a lot of students have their eyes opened on what primary care, family medicine is all about. And I'm fascinated with sharing my story and making observations and Kevin talked a little bit about just my origins and in social media, and I can't believe it's been 15 years, and we started before Twitter and Facebook with the traditional blog and long form writing, and that's where I really find my joy in that type of format. Through the pandemic, like everyone else, had a very tough time just dealing with things personally and professionally, and one of my things that I've really tried to get myself back to some kind of normalcy is to really get back to writing again. That's where I found my joy, and I wrote this piece because it really spoke to me. It really kind of spoke to what was going on in my community, and it was a joy to kind of write that and post that and share that. But it's been fun trying to get back to things I really enjoy and love to do.
So whenever you read my site on Kevin MD or you read mainstream media, there's always articles pronouncing the death of primary care, and we talk about all the things that are wrong in primary care and how there's going to be a huge shortage of primary care. But you're living the primary care life. You've done this for decades now, and you have a traditional run primary care practice which is actually in the minority. So tell us what keeps you going in primary care despite all the obstacles and challenges that face the field.
I get that question a lot, especially from medical students. And what's the deal with primary care, and why would me as a student want to do that? It's underpaid, it's underappreciated. There's not really any kind of appeal or sex appeal to it at all. I went to medical school, like everyone else, just to try to help people. And through my medical school experience, the way to take care of patients in a longitudinal fashion, and what family medicine is taking care of patients, taking care of families, taking care of patients and families in small communities like where I'm at right now, and what I've been doing. And there's a real joy with that. Of course, with any kind of job, especially in medicine, there's a lot of headaches, there's a lot of rules and regulations and regulatory factors and all that type of thing. And it's going to be there with any kind of job. But where I really get my gratification and why I still kind of keep going to work every day is that relationship with your patient, is that relationship with your patient's family, is that relationship with your community. There's a lot of students that say, hey, I don't want to be a small town doc, because patients are just going to be too invasive of your privacy, or whenever you're at the store or at church or something like that. That's a myth for the most part. And when I first got here, sure, I didn't know anybody in this community, and like everyone else, just had to find your own way. But when students come and see me, when I talk to people about it, it's really that relationship with that patient, that long-term relationship with that patient. There's a lot of talk now about the rise of things like urgent care, And is that primary care? That's really kind of a transactional relationship.
Mhm.
You go there, you're sick, and then you get treatment, then you keep going. When you make that relationship with that family physician, that you're going to get to know that physician is going to get to know you, going to get to know your family, going to get to know your medical problems, going to get to know your allergies and medicines, get to know that you're not supposed to get that medicine. You're not going to get that in an urgent care setting. You're not going to get that in other settings. And that's what I really try to convey to medical students in the community, and why I still love family medicine, and I'm going to still love family medicine. So I hope that answers your question.
So there's a lot of talk about physician burnout. We talk a lot about that on Kevin MD and on this podcast. And you talk a lot about primary care clinicians. They're backing out of clinical medicine for more of that proverbial work-life balance. Now, how do you maintain that relationship with a patient through the outpatient setting, the inpatient setting, nursing homes? You still round and see patients in all three of those settings. How do you balance maintaining that close relationship with patients with the work-life balance that a lot of doctors crave?
Yeah, I admit I don't have really great answers for that. I mean, I can share what I do, and people have to really kind of make boundaries, make professional boundaries, make emotional boundaries. Certainly with this type of job, with a demand that comes from society, I can work 24/7. Even in the age of electronic medical records and telehealth visits, and that opportunity is there. But that balance is something that you have to try to carve out for yourself, and each person is different. And me, during this pandemic, I've been trying to just try to get back to things, or to do things to really find that work-life balance, whether it's for my mental health, for my physical health. I think we, as physicians, we really want to try to do everything for all our patients all the time, at the expense of ourselves, at the expense sometimes of our families. And one of the things that during this pandemic is that there is a certain point where that cost is just too much for that physician,
Mhm.
and not just physicians, but other medical providers. And we're seeing that, a lot of medical providers are walking away from medicine completely. Is that the answer? I mean, maybe that's the answer for them. But for me, it's still trying to, even though there's all these headaches and frustrations, and when it comes to what medicine is, what family medicine is, it is that personal relationship with that person, with that family. I'm given a permission to ask questions that other people aren't, and that is an honor, and that is a gift. And I think that is something that physicians really need to recognize, and just to say to themselves, hey, this is our value, even in this kind of economic world where we're not really recognized in that fashion as primary care and family physicians.
All right, let's transition into the Kevin MD article that you recently wrote. It's titled A Shutout to Small Hospitals. Now, for those who didn't get a chance to read that article, can you just briefly walk my audience through it and share the story of why you decided to write it?
Yeah, so that article was kind of a venting type episode, which is the kind of the part of the beginning of a lot of my writing. We live here in a small town in northeastern Ohio, and when you look at the media, that they give a lot of glory to the big university hospitals,
Mhm.
Cleveland Clinic and those type of things. And what I've seen in my experience here in this small city, the things that are happening in the big cities, the very emotional things. I mean, I think it's really magnified in a small city, in a small community, because everybody knows everybody else. And the observations that I made in this piece is that, I mean, when this pandemic started, especially in our small little hospital, every day that there would be some member of the community or some organization who, would drop off food, or would recognize the medical professionals in that community. And sometime in the last year, that all kind of turned on a dime for
Mhm.
whatever reason, whether it's politics or whether it's anything else. And especially when it comes to masks and vaccines and all of that, there are really a lot of people, were directing a lot of that frustration to physicians, to medical professionals. And I'm like, that's not really right. That's not, we're trying to help the community get through this. And that's where that writing came through, is that, we were, heralded as heroes in 2020. And then that quickly turned around to us being the problem. And just wanted to just give a shout out to a lot of people, especially in my community here, who really reflected with that and said, hey, we feel that too. And, I just wanted to just give them recognition in my little way to let them know, hey, whether you're a big city, whether you're in a small city, whether you're a physician, whether you work anywhere in healthcare, that you are appreciated, especially through this pandemic. And got a lot of response from that. And there are people who really reflected on the piece. And that really brought me a lot of joy, that there's just not me that's feeling going through this.
Can you give an example or share a story where a member or members of your community turned against some of the healthcare professionals that was working in your hospital? What's an example of that?
Well, every day, especially when the vaccines started coming out, and where there were things like mask mandates and things, a lot of people, were pushed back on that.
Hmm.
And, I was kind of like the little, Dr. Fauci of my community, and whatever that meant politically for them, they were really reflecting that on me, not just on me, but people everywhere in the community, especially like in the emergency department of our community hospital. And that would be something that I would go through every day. It just, I would be trying to find out information about, are you vaccinated? Or do you have questions about vaccinations? Do you have questions about masking? And that really turned very quickly, and getting that patient after patient after patient every day. And not just me, but, the staff in my office, the people that answer the phones, non-medical people, they were getting this very negative energy from a lot of people the people that come to our practice.
Hmm.
They were getting that kind of negative energy. And it just, in addition to that, just the pandemic itself, and people in our office who, would get COVID, or they had family who would get COVID, all that stress. So all of that kind of really came together. And then when I wrote this piece, that's when the really kind of negativity was really at a high level. And that's where a lot of the origin of this piece came from.
Now, you mentioned that you were like the Dr. Fauci of your community, and I know that you appear regularly on your local television stations talking about health education and trying to educate the public. Now, did you get any specific pushback when people recognize you on the street? And did they say, Dr. Sevilla, I saw you on the news, and would they give you any pushback after your public appearances?
Oh yeah, I got both. I got both. I had some people say, "Hey, thank you for saying that." We need people locally to really speak out, and it's not really a Washington D.C. issue. And of course, yes, I would get negative feedback as well. But that's just part of what I think is being a medical educator in your community. If you want to speak out about it, if you want to speak your heart about it, if you want to speak the science about it, you really have to take the good with the bad. But for the most part, it has been positive. But there's always that one or two people or one or two experiences that really bother you. But yeah, I mean, it's some negativity, but I don't reflect on that.
Now, do you have any success stories? Because one of the things that we certainly talk about being physicians who are prominent on social media is that we want to change a few minds, certainly not change every mind, but just change a few minds. Now, are there any success stories that you could share from being a public physician, and any minds that you may have changed through your public or social media appearances?
Oh yeah, I mean, I have a few, and they all have to do with the vaccine, and being a family physician, and having that longitudinal relationship, with patients. Younger people. People are always talking about younger people and vaccines, and have them not getting a vaccine. But well, having those regular conversations with them for 6 months, for 9 months, for 12 months. I would get a little notification from the pharmacy that they got their vaccination.
Hmm.
And that is what is part of what drives me being a primary care physician, a family physician, is that we do have that longitudinal relationship that, I'm not going to convince anybody with 90-second interview on the news. But, if my patients see that, and then that opens a conversation in the exam room that we can, dive deep into it further, or I can refer to my website, or I can refer to my social media pages where they can explore it more. That is part of what I do. Not only, having a medical license, but being that voice on social media, which is, as you know, can be very negative. But we do need physicians out there, as you've been saying for a long time, to really, tell the right story, tell the science, to battle back over all this negative and incorrect and misinformation that's out there.
We're talking to Mike Sevilla. He's a family physician. He wrote the Kevin MD article, A Shutout to Small Hospitals. Mike, are there any misconceptions about working or going to a small hospital that you want to clear up for the Kevin MD audience?
Yeah, I mean, it's, there's all these kind of characterizations out there that, it's kind of like an old boys club, or it's not very welcoming to people outside of the community, or it's very cliquey. I mean, none of that is true. I mean, of course, when I started there, I didn't know anybody, and you just have to start just putting yourself out there and talking to people. And I guess another, a misconception about small hospitals is that, they're just kind of we're just the feeder hospitals for the university centers, for the Cleveland clinics and things. And we've learned to take care of a lot of medical conditions in a community hospital, because, there have been many, many times where, we've been told that there are 0 beds in Cleveland, there are 0 beds in other tertiary centers. And, we do take care of sometimes complex medical cases, and we do have the specialist coverage, we have the hospitalist coverage, we have, the primary care coverage there. We have all the facilities like radiology and imaging and all of that. So I hope that especially the general public, still, has faith in the small community hospital. I think one of the slogans around here is that we deliver kind of world-class care, in a small community. And I really feel that, the public, and especially the public here in this small community, they really appreciate the hospital. They know that they may have to go to the big university setting in certain occasions. But for the most part, small communities, they support their small hospital, they support their churches, they support their local organizations. And that's why I work in a small community.
And my final question, what are some of your take-home messages that you want to leave with the Kevin MD audience?
I thought about this for a long time, and especially physicians, that were going through this pandemic. And, some of us, really, went to a dark place, or maybe are still in a dark place. For me, just trying to get out of the negativities, just really trying to find some kind of joy to try to get back to where we were before the pandemic, whether it's, doing things that you didn't have time to do before, or connecting with people that you haven't, been able to do before. But also, there are some of my colleagues who are just so negative now, that I just had to just cut them out of my life, and so in addition to finding the joy, sometimes you just, for some people and some activities and some places, you just have to cut that out. We really have to try to be together for each other, to get through this. And everybody has to find their own way. So everybody's self-care journey is different. I'm just happy to kind of share mine out with everybody, to hope to have that resonate with people, especially in my small community.
Mike, thank you so much for sharing your stories, time, and insight. And thanks again for being on the show.
Good to be here. Thank you.